Hello everybody, in this video we will speak about the reaction to the remedy. So we usually meet with the patient after 3 or 4 weeks. It depends on the acuteness of the problem. Sometimes when the situation is very acute, I see the patient in 1 week, but sometimes 6 weeks are enough. And there are a few typical reactions. Of course, the reaction can be various, but some appear more frequently. So the most agreeable reaction to both is that the patient feels step by step he feels better and better, and it's quite fine. Another situation is that after starting of the remedy, there is some aggravation of the complaints, but this aggravation is not so serious, so the patient believes that it belongs to the therapy and he continues and continues, and then it switches and he starts to feel better and better. Both these reactions are optimistic, positive. The third reaction is much more difficult, and we should think it may appear. In my experience, it frequently appears, for example, after agrimony, which often opens some conflict, some problem in the family, and suddenly it graduates the problem that the patient calls you that there is something terrible happening, and he has a fear that he cannot control the situation and asks you for urgent help. And it's very, very important in this situation to meet the patient or to calm him down, to give him, for example, crisis essence, to help him to overcome this situation. And it usually needs a few, sometimes even a few hours, sometimes a few days to get better. And after that, the condition of the patient gets better and better. The reason is that there was some crisis. The remedy provoked some crisis that needed to be overcome. So it's an important healing sign of a healing process. But of course, the patient, when he is in the center of the problem, he doesn't understand it. So the explanation is very important, and the support. And if necessary, you can give him the crisis essence. You can also reduce the dose of the remedy, for example, to 2 times 2 drops, or even 1 drop daily. But sometimes even the replacement by crisis essence for a few days is necessary and helps. But it is, in fact, it is a positive reaction, but it may have sometimes a quite dramatic course. And the fourth reaction is some fluctuation. The patient has some chronic problems like headaches or some conflicts, and they sometimes get better, sometimes worse, and it's quite difficult to assess it because the patient usually comes in this worse phase when he tells, well, last week it was still quite okay, but this week is terrible and it's all back and so on. And these patients often need some support in the form of gentian or gauze, and if you yourself feel discouraged, you also should take something of some of these remedies, because it usually signals that the therapy will need quite a long time, and these people usually do not agree easily that there was some progress. And it is especially difficult to assess it because there is a fluctuation. So sometimes it helps to ask whether these best moments after the remedy, when the patient felt the best, whether when he compares them with the situation before. And similarly, he can compare the worst moments with the situation before the remedy. And sometimes he agrees that there are some very good moments that haven't been before, and that these bad moments aren't as bad as he used to be. And of course, it's possible that he doesn't agree with it. He tells it's the same, even the worst, even the best moments. And sometimes more time is necessary, so some adjustment, make some adjustment and wait. And maybe after 2-3 weeks, 3 months, there may be some progress. But it's difficult to predict the development of this case. And finally, there are two reactions that are negative, and it is when the patient comes and tells you no change. And even when you try, you ask in various ways, he refuses any effect. It's the same, no change, no, it has no effect. So it's highly probable that this patient won't react to the remedy. There might be a block to the therapy. For example, the patient was pushed into the therapy by his wife, or he has some problem to accept it. Maybe he believed that it would solve all his problems, and he neglects minor changes. But the work with such patients is quite difficult, and maybe he needs to wait some time and start another try, or maybe another therapy would be suitable for him. It's difficult to predict it, but it's highly probable that the therapy will be unsuccessful. And similarly, when he feels worse and worse and nothing helps, it's not a problem. It's usually not a problem of your combination, but it's usually a problem that he is too passive in the therapy, and he just expects a miracle, and there are no miracles in the real world. And how to assess the effect of the essences. Okay, the patient tells you that there is some change, but this effect can be on more levels. Of course, there might be a change of emotions and thoughts, but there also might be a change in behavior. For example, the patient may describe that he used to avoid driving. For example, his wife drove car instead of him, and now he started to drive himself. So there is a sign that his courage has grown a little bit. Or there might be maybe changes on physical level. For example, the frequency and intensity of migraines reduced, or his backache is not so disabling. And there might be a change on interpersonal level. For example, some people describe that they have not noticed any change, but his wife told him that there is a change. He behaves differently, he is more calm or more accepting, for example, or there might be even more quarrels at home, because till now he was submissive and accepted everything, and now he realized that it's a time for change has come. And finally, there might be a change on transpersonal level, or moral or ethical, or the level of life values. For example, the person may convert to some religion, but it's very rare. But the transpersonal or ethical moral change may manifest, for example, in the fact that a person that spent most of his free time at work, he spends more time with his family, with his children, because he realized that these children need him, and that the family is more important than his work. So how to assess that this change is stable and it will continue and it is really an effect of the essences. There is a rule of two. This rule of two tells that the change should be at least on two levels. To znamená, it means, for example, on the level of emotions and physical symptoms, or on interpersonal and on the behavioral level. And another two means that this change should be continuous, at least during two follow-ups. So then if during two follow-ups you observe the same change and this change continues and is more and more significant and positive, so you can tell that it is the result of the remedy and the result will be lasting. So thank you very much for watching this video. I hope you have enjoyed it. And in the next video we will speak about how terminate the therapy.